Hi everybody, I'm in between surgeries and I just want to take a minute to explain a little bit about Brazilian butt lift safety and why patients die. I was saddened to hear about a patient, Joselyn Cano, that some of you may follow. She has a large following on Instagram, who went to Colombia and had Brazilian butt lift surgery. So as you probably know, Brazilian butt lift surgery really involves liposuction and then fat reinjection into the buttocks. So to get a result, a lot of fat is injected in the buttocks, not just a little bit because some of it absorbs. So in the process of injecting fat, we make little tiny poke holes and then we're introducing fat through long, kind of like oversized needles. We call them cannulas with blunt tips. And when that fat's injected, it can be injected in different layers, including in where the fat exists or in the muscle. And when I was in training, we're actually taught to inject it that way 10 years ago into the muscle. And we've learned since that time that that's not a great idea because the large blood vessels, the veins and the arteries exist in the muscle. And I want to show you a quick diagram here in a minute of this, but it's very easy to inadvertently enter without realizing it, those large blood vessels, and inject fat. And that fat will immediately go to your heart, which is then sending unoxygenated blood to the lungs to oxygenate the blood. And when the blood vessel splits to go to your lung from your heart, the fat can lodge there and block both sides. We call that a saddle embolus. And that's from fat. And that could obviously also happen from your legs throwing blood clots, but in this situation, it's from the fat. And when that happens, it's almost impossible to save someone's life because you just can't cut them open and get that fat out in time. And there's usually some fat around, it's clogging up the lungs and you're just not getting oxygenated blood. So it doesn't matter what we do, you're just not gonna survive that event. So what we've learned since that time is we don't wanna inject fat in the muscle. So a very experienced surgeon will know when they're in the muscle and when they're in the fat and should be able to keep that tip in the right place, just like an experienced liposuction surgeon knows not to enter the wrong cavity with a liposuction tip. So everybody needs to stay safe. Make sure you're seeing board certified plastic surgeons. Make sure you're seeing somebody who can do this regularly and with a good safety record, and realize that it should be able to be done safely, and hopefully these will all be eliminated one day. Here is a quick look at those blood vessels. You can see the blue are the veins and the red is the artery, and it's very easy to enter those with your tip. So hope everybody has a great holiday week. I'll talk to you later.